Let's talk about metabolic syndrome. If someone develops metabolic syndrome, then they're at an increased risk for developing chronic diseases that affect most Americans today, including diabetes, cardiac disease, mental illness, or even cancer, just to name a few. But how do we even know if we have metabolic syndrome? Typically, we go to the doctor, and for our annual checkup, they order a set of labs, including glucose, HbA1c, and the lipid panel. Unfortunately, the numbers on this test can actually stay normal for quite some time, and by the time it does show up on the test as abnormal, then you've already actually had metabolic syndrome for several years or even decades. So what do we do instead? Well, there are two ways that we can detect whether or not you have metabolic syndrome much earlier in the disease course. The first being a lab that unfortunately most doctors don't use on a regular basis called fasting insulin. With this lab, we look at how efficiently your body is using insulin to drive down blood sugar. And you could go ahead and ask your provider if they could order the lab for you, but sometimes you might be met with some resistance. If that's the case, then you can go ahead and go to ownyourlabs.com to order the lab for yourself, and then you can go to somewhere like LabCorp to have the lab done on your own. So when you receive the lab result and you see a 10 or higher, then that indicates that you have insulin resistance and thereby very likely metabolic syndrome. The second way is to look at a set of 5 criteria. The first of the criteria is central adiposity. That's either a BMI of over 30, or for men, a waist circumference greater than 40 inches, or for women, greater than 35 inches. The second criteria is high blood pressure. So what this means is either a systolic blood pressure greater than 130 or a diastolic blood pressure greater than 85. In the third criteria, that is elevated blood glucose, which means a glucose higher than 100 or an HbA1c greater than 5.7. The fourth criteria is high blood triglycerides, and that is triglycerides greater than 150. And then the last criteria is a low HDL. That is, for men, an HDL lower than 40, or for women, an HDL lower than 50. If you satisfy 3 of the 5 criteria, then that indicates that you have metabolic syndrome. So using these 2 methods, you can know whether or not you have metabolic syndrome. If you've determined that you have metabolic syndrome and you want some help, then you can head over to my website at kevinchenmd.com, where you can book an appointment for a consultation with me, and I would love to help you reverse your metabolic disease, because a healthy body is your birthright.